name is Felagot Taddese. I'm a medical doctor and obstetrician and gynecologist. I'm currently serving as a country manager for CPAR, Canadian Physician for Aid and Midwifery Ethiopian office. CPAR has developed a project called RUA, Remote Ultrasound for Antenatal Access. And this project tries to address this persistent gap in maternal health service delivery in Ethiopia, particularly focusing on making obstetric ultrasound accessible for rural women. So when we ask why this obstetric ultrasound is not accessible for this woman, one thing is the limited number of professionals that can do this obstetric ultrasound. So before the project implementation, this ultrasound used to be done only by obstetrician and gynecologist or radiologist. So the health centers, they only have midwives or other mid-level healthcare professionals where they were not trained to do this obstetric ultrasound. So this project came up with the idea of task shifting the basic obstetric ultrasound service to mid-level healthcare professionals like midwives and health officers. There were 13 midwives and health officers were trained from 2 health centers on this basic obstetric ultrasound service. The other innovation was the tele-ultrasound services. So what we did is we have used a tele-ultrasound platform where these healthcare providers, after training, have an opportunity to have coaching and mentorship by remotely placed obstetrician and gynecologist. So using the telemedicine platform, the obstetricians who are located usually in the bigger cities will guide, give advice or support these healthcare professionals using the tele-ultrasound platform. So the first thing is we have seen improved coverage of antenatal care. So more women tend to come to the health facilities. So previously, because they don't have ultrasound, because they have bad outcome and so on, there is a tendency that women do not come for antenatal care. So antenatal care coverage has significantly increased in the implementation side. And we have also demonstrated a strong buy-in from the health system. So this was reflected by the response from the regional health bureaus and also the Ministry of Health.
We have been able to get funding to scale the pilot in Tanzania, and that is just beginning. Right now, we are adding a component, so we're adding some AI to it so that the taking of the images through the ultrasound will be somewhat easier. We're actually having mobile clinics we will move around with to go to where women are in remote and rural areas and provide those services to them, but using the same model where we would have the specialists in urban areas that will then help read and interpret the images that are taken.
This new idea is now even being used for other healthcare problems. So in conflict-affected areas and so on, we are using even these new ideas. So they are now being encouraged to make different services accessible for women. So these innovations are really critical in solving different gaps. I really understand and feel the gaps of especially women from rural areas, from conflict-affected areas and so on. They are really having limited access to the basic things in life, and they are suffering. They are even losing lives because of lack of the simple interventions. This really makes a difference in millions' lives, especially in Ethiopian community. We expect 3 million, 4 million pregnant women annually. And we know the number of obstetricians and so on we have is less than 1,000.